The whole idea of what we are doing here, even though most of you already know me and know my work, is understanding that this is my paradigm and my understanding and my philosophy and how it is that I view things, and not the truth per se, but just how it is that I see things. And my objective is to really share that with everybody and put my experience and who I am on the table, and through these eyes see Chinese medicine, and not necessarily the view of Chinese medicine as a whole, because Chinese medicine have many different schools of thoughts, and I'm going to get in a second into some of my education. But the reason I'm saying that is I want to have an understanding that any shortcoming, any representation that might not work specifically this way or another is not the medicine, but mine. Because another practitioner or the medicine itself is much bigger than me. And this is just my understanding of it, coupled with who I am and my life experiences. So don't look at me as the representative of Chinese medicine. That's very important. Because if anything happens within Chinese medicine, I don't want you to look at that as a reflection of what it is that I do. Also, when you look at the different schools of Chinese medicine, we have to start with the fact that Chinese medicine is really not Chinese medicine. At one point, it adopted that name, but really it is Taoist medicine, and the only place it was developed and existed was within the Taoist religion, the Taoist philosophy, or the Taoist sect. It happened that Taoism was that sect that existed in China at the time, but it was just within the Taoist. Obviously, there was a lot more Chinese people, but the medicine as we know it, the acupuncture, the herbs as I practice it today, only belong to the Taoist people. When Mao took over and he nationalized basically everything, it became Chinese medicine. And up to that point, nobody referred to it as Chinese medicine. And he developed it and nationalized it and made it into their national medicine with all the movement that came with that. So when we're talking about that, remember when we're talking about classical medicine, which is pre-Mao, true Taoist, and what you hear of TCM, which is traditional Chinese medicine, which is post-Mao. And all the schools that you actually see here today in California and in the US that teaching Chinese medicine are actually TCM schools. They're traditional Chinese medicine. All of them teach the medicine in accordance with post-Mao understanding and philosophies. Some of them, and where you see the movement is that post-Mao did a little bit of a migration into a Western approach into disease. So it's more symptomatic and categorization of disease based on disease, not in imbalances based on the individual. You guys know my work for my work because what I practice is the classical Chinese medicine, the classical Taoist medicine. When I graduated from a TCM school, I continued my education. That was, when did I graduate? 14 years ago. I continued my education with a Taoist priest who has been my teacher ever since. So I follow the classical medicine, not the TCM one. So a lot of the concept and the ideas that I talk about, TCM doesn't talk about. Now coming back to that, so talking about Chinese medicine, it's very interesting that when it started spread over to Korea and Japan, mostly not as much the Japanese, but the Koreans got really sensitive about the idea that they're calling it Chinese medicine because they wanted to be included and it's important to them. So the term was then changed to Oriental medicine. And actually, if you look at the office at my certificate, since the owner of my school was from Korea, it says Oriental medicine. Doesn't even say Chinese medicine.
Was there Taoist medicine in Korea and Japan, or just in China?
No,
Like, was there
that was all
Taoist
post.
philosophy?
That was all post Mao.
Okay, but did the philosophy exist in China and Korea and Japan?
To a degree, but their treatment and their modalities are different, and their approach is very different than the classical. When Mao took over, Taoists ceased to exist as we know them in China. A lot of them fled because he basically killed as many as he could and destroyed the temples. So a lot of them fled, and whoever that stayed there went into hiding. So a lot of them resurfaced later on in the US, Canada, and very big in Australia. So, but no, so post-Mao is what migrated. So it was known as Oriental medicine. And actually, as it made its way through to the West, it was no longer PC to say Oriental medicine, so they changed it to Asian medicine, which actually works really well for me because Israel is in Asia. So it's really Israeli medicine that I practice. So it kind of works its way back to me. But leaving jokes aside, I want you guys to understand the difference between classical Taoist medicine and post-Mao TCM. And there's a big difference there. Part of the thing is I would like to promote and put out there is that part of my practice, other than obviously taking care of what needs to be taken care of, is really to give you guys more questions than answer. I believe that if I managed to get you guys out of your comfort zone where you start questioning your life and questioning your health and questioning your action and questioning what it is you perceive to be your reality and your health, and start doubting all of that and try to start looking at other possibilities, then I have done my job to get you guys to start exploring whatever it is that need to be explored outside of where it is that your comfort zone. So far, everybody's okay with me? Questions? Beautiful. Another thing that is important to understand when we start talking about Chinese medicine and Western medicine, and don't get me wrong, again, we talked about it the last time, I have nothing against Western medicine. I think Western medicine is fantastic. It's got its place, it's got its time, just like any other modality. Nobody is better, nobody is worse. We're just different. As I said in my last lecture, if I get into a car accident or I break my leg, please don't bring me to my office. You know, dial 911, take me somewhere else, don't bring me to my office. So there's a little bit of differences there. And the reason I'm trying to highlight the differences is to really make it more clear what it is that we do from our perspective and what it is that is our paradigm and how it is we look at it. But when we look at medicine and we look at that as a philosophy, what really it is, what we're talking about is the approach to how we deal with disease. And to really deal with how it is we deal with disease, we have to define what health is, because it all begins with what it is that's our definition of health and disease. What is it really sickness, and what does it really mean to be healthy? But also from that perspective, we have to look at each medicine and its philosophy within the culture that it was born in. Because everything that was developed in a certain culture that had a specific philosophical view on life that developed that. So touching it a little bit, when we look at Taoist perspective and Chinese ideology at that time, what we're really talking about is the laws of the nature, how we look at nature, and we understand that there is natural cyclical movement, and also the individual was not as important and is its place in society. Nothing existed in isolation. Everything was only as important as its piece, its part within the whole picture. So the whole picture was what was important, not the individual parts. It's just the individual part as how it related and created or was a part of the whole picture. And that was part of it was Confucianist ideas that were mingled within Taoist belief. Everybody's okay with that so far? Excellent. When we look at Western medicine, we look at our philosophies, how we developed in the West. The whole idea was about how we individualize, how we look for the smallest particle, how we, the self, is more important, and how we are here to find ourselves and express ourselves, and how we lost that movement as our place as the whole, but really about how we flourish as ourselves. So when we look at the medicine, here we have a medicine that does not concern itself with the details, only in its relationship to how it creates the pattern of the whole. And here we have a medicine that does not concern itself with the whole picture, but only with the details. And that detail is what creates that and how we look at that. Another thing is, since we are talking about nature as the basis. If you look at Taoist philosophy, the basis of their philosophy was about observing nature and the natural cycle of what they consider the universe or our existence. So a lot of the terminology and the ideas have to do with natural movements. So when we look at a physician, we look at ourselves more as gardeners. When we look at the human body, I shouldn't even say the human body, because it's really not about the human body. When we look at that person, whatever we want to call it, that entity, we're really looking at, just like we would look at a flower. The idea is not to fix things, but to promote health. So if we're talking about just like a flower, does it need more water, less water? Does it need more shade? Maybe less shade, more light, but not direct sunlight. And now we just took in the plant. Now let's talk about the soil and how that, the root system, the environment, how that affects that plant. Bless you. And when we look at the plant, we can say, okay, maybe the leaves are too green, maybe the leaves are too yellow, and we make adjustments to promote that maximum health. Versus when we talk about Western medicine, it is more of the idea of a mechanic. You go in, you get plugged in, the report comes out, you know what's broken, what's not working, what's deficient, and then you make adjustments and you fix those things. And a lot of the mechanics of that medicine really is working like a mechanic, things that need to be fixed. Also very interesting, when you understand that, the focus of the medicine is very different. When we're talking about, and again, just for the sake of this discussion, I'm going to call it Chinese medicine. Because of that, the focus is the patient, is that individual that's experiencing the imbalance. Versus Western medicine, the focus is not on the individual, it's on the problem. So they fight disease, we promote health. Philosophically, it's very different, even though we might both use similar things to address that, but philosophically and our approach is very different how we look at that. And that comes back to the idea of what is really health and what it is really disease. When we're talking about Western medicine, basically until there are symptoms, we're healthy. I think we hear ourselves say many times, there's nothing wrong with me, I'm healthy. Yet we're not functioning properly, our energy level is not good, our digestion is not good, our sleep is not good, our bowel movement is not good, we have allergies, whatever, what have you. But we don't consider ourselves sick because nothing broke yet. There's no, we didn't get a heart attack, and we hear that a lot. I don't know what happened, I was really healthy until I had a heart attack. Right? We hear that. Or until that stroke, that person was in great shape. But really, the idea is that we are healthy until something goes wrong. So Chinese medicine, on the other hand, view sickness, the first step is we are off balance. So the minute things start to shift from being in that perfect balance, we are already considering that a disease state. So our gap between being sick and not being healthy is huge. And there's a big gap between being sick and not being healthy. So think about being sick is versus where Western medicine steps in, and where we step in is versus where you're not healthy. And that happens much sooner. We talk about Chinese medicine or a lot of alternative or holistic approaches from the perspective of preventative medicine. But this is not a true statement, because we are not really preventing from the process to start. Because from our perspective, it already happened. We're just treating it early enough to prevent what we call the visible manifestation of that disease from occurring. But in our perspective, we didn't prevent anything because the process has already begun. We just recognize it a lot sooner and able to address it in a much different way. Important concept. Everybody's okay with that? No, especially when we're talking about the whole notion of the idea of holistic medicine, again, going back to nothing exists by itself, but how we take those symptoms that we may exhibit and how we weave them together into a pattern of disharmony that then gives us a picture of this is where that person is in balance. And Chinese medicine, as you know it, does not separate between physical, emotional, mental or spiritual. It's all manifestation of who we are in our existence, balance or imbalance. So that's another thing that we tend to look at something that is separate, our body from the rest of us, but it is not. And a lot of times the symptoms will also weave between that, and you need to identify those as the cause of disease or the outcome of that. Another big difference within that, and that's actually started with a very nice gentleman named Louis Pasteur. Everybody familiar with him and his theory, the germ theory? What people don't talk about is that later on in his life he recanted his theory as being wrong, but they just talk about his first publication. Thank God for video these days. We can go back to you said. But his basic premise was that all disease happens because of germs. Germs cause disease. They are the only cause, as far as we know, for disease to happen and nothing else. And that was really the school of thought that was adopted by the Western world physician at the time, who continued until very recently to be the prevailing school of thought. The diseases are caused by pathogens, not having anything to do with us. Again, it's a huge shift in what I consider to be consciousness, because what he did, in my opinion, that was the biggest disservice for us as a society, and obviously I grew up in that society too, it removed the responsibility for my health from us and put it on somebody else. All of a sudden, we were no longer responsible for our health or our well-being or actually anything. They did it. So you went to the doctor and had the doctor fight them. Leave me out of it. What do I have to do with that? And that created a huge gap and a separation between us and accepting responsibility for our health, well-being, and our understanding how much it is that we contribute and actually cause the creators of our health or disease. Now, I'm not saying the germs don't affect us, but if you think about why do they affect some of us and don't others, we're all around germs all the time. Why the same germs sometimes will affect you and sometimes they won't. David is hiding from me. So on that level, what I believe is that we need to bring that back into the idea of we are responsible for our health and we are the creators of what it is that we do by our choices and our consciousness, and not put that on somebody else. And that brings back health and medicine into us, dealing with us to fix whatever it is, not fighting disease. Because if you look at, really, even if you go to the hospital today, the patient doesn't really exist. Everybody fights the disease. The patient just happens to carry the disease, but the patient is really not important. It's the disease that's important. And everybody fights that, either antibiotics or whatever that is. The patient really have no room within that relationship. Versus, for me, that relationship is the most important thing. And those are really basic concepts, but are really huge with how the philosophy of what it is, the treatment and disease and health and medicine, really where they split and where that gap started. Everybody's okay so far? Any questions? Any comments? You guys are a quiet bunch. Nothing. Okay?
Well, one thing I'll put towards you is that in Western medicine, they deal with the disease chemically, where what I found out in Chinese medicine, you're through the acupuncture process, you're going after certain organs to balance the body,
Right.
to prevent the use of chemicals.
Right, and I'm going to get into that in a second. Yeah, that's a very good point. That was actually my next point. Because again, when we're talking about what is health, which we already established, what is disease, which we already established, and now we're talking about how the approach of how do we address that. Again, here we're talking about certain introduction of man-made materials or plant derivatives to help we introduce into the body to fight that disease and work within that, versus with our understanding that everything that needs to exist is in the body, and if you know how to work with it, it's got everything that it needs to correct itself. So when we're talking about Chinese medicine as the modalities of treatment, acupuncture will be one of the families, the herbs will be another one of the families, diet, exercise, what we call lifestyle meditation, and there's a field that's called Twina, which is not very developed here in the West, that is a combination of physical therapy, what you consider chiropractic work, and massage. It's a huge field within Chinese medicine that talks about those kind of treatments. Unfortunately, in the West, it's not very developed, and due to its dramatic effect, acupuncture made the biggest name because people saw needles in magazines, and again, for dramatic effect, you saw about 90 of them in someone's head in Times magazine, I think it was. So acupuncture made the biggest name, but acupuncture is only one part of the families within Chinese medicine. You know, we talk about diet and exercise and meditation and lifestyle changes and how that works within those modalities together, even though sometimes we do use herbs, as will be the introduction of substances to create certain effects within the body, but those will be more of the natural substances versus man-made chemicals. And we're going to go into that. Actually, that will be our next lecture when we go into the treatment modalities of Chinese medicine. We're going to go into each one of them. Was it really, what is it really that acupuncture is, and how does it work, and everything about it. So we're going to go into that the next lecture. What I'm trying.
And what I'd like you to do in that next lecture is, for example, lipitor's, they're going to reduce your lipitor's reduce cholesterol, but the issue is they beat up the liver.
Right, and we're going to go into all of these side effects and all of that stuff. What I'm trying to do in today's lecture is really lay the foundation of the understanding of the philosophy, because then when we're going to go into the deeper aspect of what it is we talk about, you're already going to have the understanding of this is how we approach health, this is what disease is, this is how we really look at it, because really what we are talking about is really a shift in consciousness. It's really a shift in how it is, not only you view your body and your life, but how it is you really look at health. And what is it really health? And what is it really disease? And how we view that. And when you're able to look at that from my perspective, then your consciousness shifted on that. And then we can talk about all the other things. But really my goal is to get you, which I said at the beginning, to question your current perspective and get you to shift and go, wait a second, I never thought about it like that. Maybe. I'm not saying it is, but maybe. So something to look at that. You had a question, Serena?
Yeah, just
go ahead.
Has acupuncture stood up against the scientific method? Because I don't know if it's irrelevant, but
It is irrelevant, and I'll tell you why. It's not that it did if you apply it within the Chinese medicine paradigm.
right.
But where they try to apply the scientific method with acupuncture is with the Western medicine paradigm. And it's not going to work like that. Because, for example, if you talk to me, I'll give you an example. If you say, let's check the efficacy of liver 3 in migraines from environmental factors or something like that. Well, not all migraines in Chinese medicine come from liver pathology. I need to do the diagnosis. And we have a saying in Chinese medicine that talks about same disease, different treatment, different disease, same treatment. So you might have 5 people here in the room that's having migraines, but from my perspective, from Chinese medicine perspective, all those 5 migraines will come from different etiology as far as an imbalance in the organ. So if you apply Chinese medicine philosophy to the scientific method, then it works. But if all of those 5 people have migraines, but you're checking migraines from liver pathology, right? Then out of these 5, only 1 will come positive. The rest will come negative because it's the wrong treatment. Still migraine, but it's the wrong treatment. Because with you, I might treat the liver, and with him, I might treat the lung, and with her, I might treat the kidney. Right. So all of you will get results for your migraine. But if you check from liver, all of them will come, no results. So you go, wait a second. That doesn't work for migraines. No, it doesn't work for migraines on that narrow understanding. Did that answer your question?
Yes.
Okay, because when I look at each individual, that's why I said we are not treating disease. We are treating an individual that's having an imbalance that results in a symptom. The scientific method, as we know it in the West, is designed to work with disease, not with individual. Take this drug, will take everybody's headaches away. Or take this drug for liver pathology. It will work on that liver pathology. But then they classify that. But not everybody have the same issue because of the same problem, and then it's not going to work. Go ahead.
In Western medicine, you go to the doctor, something's really wrong with me. Oh, let me take a blood test. In Chinese, then they take a blood panel. In Chinese medicine, is there an equivalent to that? Do you ever
Yes.
take a blood test?
Yes, not blood test. If you look at it when we're talking about levels of existence, we're really talking about either energy, gas, liquid, and solid. So Chinese medicine, let's start, Western medicine usually check liquids first, and sometimes solids. So they send you to the lab to do some kind of stool test or X-rays or whatever on that level. They're not very good with checking energetic changes because there's really no machines to check that. So a lot of the times there is a gap there and we are not able to detect things, and you hear that a lot, saying the person is really not doing well, but all the tests came fine. Why the test came fine but the person is not doing well? Because it's not going to be detected in the liquid or the solid level. And we just don't have the equipment to measure it in that level. So, having said that, Chinese medicine have its own diagnostic methods, and we can go into all of them. One of them is palpation. You see practitioners that take the pulse. You see practitioners that look at the tongue. And then there is what they call observation and questioning, which is what are my widely used diagnostic techniques. I observe things, I see things, and in the next lectures, we're going to go into each organ and what is it really manifestation that you're able to look at the person, anything from complexion to shape. There's many different things that we can go into that you start mapping what it is that's imbalance. The other thing is questioning. My first question, usually, when someone comes into my office is, how you doing? Right? How you doing? Seems like a very innocent question. Or some people are like, what's up? What I'm really asking you to do in this place is to stop for a second and think about yourself and go, okay, I'm actually making you scan yourself. And now you start.
You still here?
No, that's when I take the needles out.
That's your last question.
With you is usually, what's my coffee? Do you miss me? That's when you come in. Did you miss me?
About 6 hours into the flight when he woke up from his nap. Are you still here?
And you have needles in you?
Surprisingly.
No, but really,
We should have.
we're starting to talk about really how are you doing? How was your week? What did you feel? And we're differentiating between, and we're going to go into that, organ pathology and channel pathology. Injuries and things like that will be channel. Injuries and things will be channel pathology versus internal issues will be organ pathology. Yeah? They don't always, you can have a whole channel pathology like a back problem. It will be a channel problem, not an organ problem. I don't need to know how you're doing. It's a channel problem. Or a shoulder injury if you might have one. If your range of motion is like, I don't need blood work to know your hand doesn't come up. And then we're talking about range of motion. But having said that, through that questioning, you told me that you felt this and your energy level wasn't really good and maybe your appetite wasn't as well and you really felt, kind of sad and kind of angry. Now, and we're going to go into it in a minute. A lot of those things tell me what's going on in your internal environment. So this is my diagnostic tool because by the symptom you present, I get the internal picture of what's going on with you. So coupled with me seeing what it is I need to see, and you say, wait a second, what do you see people? And then you see those people who sit down and kind of, they sit in the chair and they go with their legs like that, and then they shift, and they speak fast, and they can sit still, and they speak, in a certain way, and you start getting idea of how things are working inside of them. And again, when we're going to go into more details, you're going to understand more of that. But observation, questioning, palpation, the classical people talking about smelling and tasting. And they used to do that in the old days. You young guys ain't paying me enough for that.
Smell and taste?
Exactly. But the old days, they used to tell, bring your urine, let me smell it.
Oh, yeah.
Yeah, my teacher can smell your urine, can tell you what's wrong with you. The body fluids, they tell us the story. It's enough for me to know the details. I don't need to smell it. You tell me if it smells or not. You smell it and come back the next day. But really, if that was an issue, that would be a question I will ask you. What does it smell like? You know, color, shape, size. Some of you have been through that with me. That's important information because it gives me an indication of how the internal environment is working. We also have to remember that when we're talking about the organs, people talk about homeostasis as balance, but I don't believe in homeostasis. There's only one situation when homeostasis exists. Anybody? Huh? No, the definition of homeostasis is what? A constant balance. There's only one place that you see constant balance. In a flat line. There is no such thing as homeostasis. I like to call it homeodynamics. Because we are a dynamic being, we are always changing, we are always adjusting, we are always reacting, we are always responding, we are always feeling. It's a dynamic, constantly moving process. There is no stasis. The idea of stasis is stagnation. Actually, the word for stagnation in Chinese medicine is stasis. Stasis is the word for no movement, really. We are not no movement as human beings. So when we're talking about homeodynamics, so even when we're talking about the internal organs and we're going to go into them, we're talking about a constant, ever-changing relationship of movement, not of static situations. Nothing exists when it's not moving. That's death. So keep that in mind. And when we're talking about that relationships, we also understand that within that relationships, just like we have a husband and wife, that we have boyfriend, girlfriend, co-workers, we affect each other. There is relationship. Sometimes we get nurtured, sometimes we get nourished, sometimes we're being controlled, sometimes we're being abused. You're always getting abused. Well, you married a Sicilian woman, what do you want? But no, seriously, the other wife, not him. I'm talking about Joe.
I know you are. We all know. Yeah, we all know. Okay.
But
Thanks, Boaz.
I said she's the other woman.
I know. I agree. So thank you.
But no, seriously. So when we look at that also, when we talk about the organ system, we don't talk about them in isolation. But we have to look into the organs within their relationship to how the other organs are working. Because sometimes, even though an organ might manifest a pathology, that organ might not be the one that's sick. So you can say that David came to work yesterday and he was all black and blue. And you think, what happened to you? But really, he wasn't the one that had the problem. Michelle had a bad night. So,
As long as we all know.
Yeah.
but my point is that sometimes you have to look beyond the organ that presenting the manifestation to look for the answers. And I think that's another area where Chinese medicine excel because we understand the relationships versus, again, Western medicine view each organ as a separate thing that exists by itself. Actually, even within those organs, if we talk about enzymes or whatever, hormonal changes or structures, we look at them as something that exists by itself with no relationship to anything else. But if the pathogen is not there, then even though the patient is not doing well, we can find the answers because the problem is not there. Who is it really the one who is manifesting those pathogens? And the idea is really, when we look at the body, is it really all just physical? And are we really viewing ourselves as just a physical being? and all of our ailments and all of our issues are really just physical. Western medicine created separate fields for that, but when we're talking about medicine, we're really truly just dealing with the body. Versus Chinese medicine says no. It might manifest also in the body, but if you look, you're going to see that the same pathology will manifest in other aspects of that being. Versus it will be their emotions, versus it will be in their mental capacity. And when we're talking about stasis, or we're talking about stagnation, to give that as an example, liver chi stagnation, we can talk about somebody who get migraine. We can talk about somebody that have issues with painful periods. But the same token, we can talk about somebody who's having anger issues, impatient, or writer's block, and they're just having this feeling that they're stuck in their life and they're just not moving anywhere. And for whatever reason, all of the things that they really desire, they just can't seem to generate that and create that because they're stuck. So you don't always have to come to me and say, Boaz, I have a migraine, because it's enough for me to know all of those other things, for me to already know what imbalance exists in your body. I'll be surprised if you're not going to have some of those other things, but not necessarily, because we all manifest them in different ways. So far, is everybody okay with me? I think to just say one more thing here for Western medicine here. I think as a society, we are doing a lot of disservice for those guys. I think they're doing fantastic work. Some of my best friends are doctors. Funny enough, I don't know why, most of them are ER doctors. They all can save lives, no problem, even though they know nothing about health. But no, seriously, and we have those discussions all the time. When they want to understand health, they come to me. But again, if something happens to me, please take me to them. But I think as a society, we put those guys on a pedestal, and we have a certain level of expectation that is not reasonable. And I think it is up to us, the people, to understand who to go to and when. The same way you don't want to have kitchen cabinets. If you want kitchen cabinets, you're going to go to the carpenter. You're not going to go to the welder and then be mad at him that he doesn't know anything about wood and why the cabinet is all hard and makes metal sounds, So I think and this is why I like doing a lot of those lectures and talking about it. And I don't know how much of you guys know, but I also lecture for the mid-level medical staff, for all the Southern California hospital, all the ER. I lecture for all their nursing staff, and I teach them basically the same lecture and things as I'm talking to you guys. Actually, if I'm not mistaken, I'm the only Chinese medical guy here that is authorized and approved by their association to give them a continuing education unit to teach them about medicine, which is kind of cool. But the issue always comes up that it's really the level of expectation is not reasonable, because this is not what they're trained in. Yet we expect them to know everything about everything. It's like you go to a post-production guy and ask him to do a pre-production thing, or somebody who does editing, you want him to do sound. It's just not reasonable. So, except Aaron, he needs to do everything. But other than that, really I'm trying to give them the credit where credit is due. They know what they do, what it is that they are trained in. And I think a lot of our expectation of them is just not where it needs to be. When we're talking about also health versus fighting disease, going back to I'm fine, there's nothing wrong with me, I invite everybody to really think about it and take an inventory of themselves and really say to yourself, am I really the best that I can be? Can I be better? Is my energy level can be better? So my digestion can be better? My elimination can be better? My feelings, my emotions, things in life can be better. If they can be better, then as far as I'm concerned, from our perspective, you're not healthy because you are not optimal. Again, there's a big gap between being sick and not being healthy. So for yourself, when you go home at night, think to yourself, am I absolutely the best that I can be? I might not be sick, but am I really healthy? I have allergies and I can't really eat that, and I haven't slept really well, and I have this constant anxiety, but other than that, I'm healthy. So take your own inventory and really think about, are you really healthy? And this will always be your own measure for yourself. What it is that are you really optimal or not? So having said that, any question before we move on? Nothing, huh?
But also, I was just gonna say, I feel like, I mean, also there can be like a preoccupation with everything that's wrong, you know? Like, if, I mean, I feel like as humans, like, we're constantly evolving to more expanded states, and if you're like always like, how am I, like, what's wrong with me, or like, how am I not healthy, you know? Like, what's the balance in that?
I differentiate between worry and awareness. I'm not saying worry about everything wrong with you, but be aware. You need to know, just like you know that if you walk straight, if your walking is good or not. You don't think about, oh, am I walking okay? Is my step okay? You know it. What I'm really talking about is awareness, not worry. Not, oh my God. I'm not talking about worry. I'm not talking about anxiety. I'm talking about awareness, about being able to know. Am I really the best that I can be or not for yourself? And most of us walk around, we know, we don't need to think about it. We know how we feel. It's not necessarily something you need to obsess over and worry about, but it's something you need to know, because at the end of the day, your health is your responsibility. Even if you go to the doctor, I can assist you, I can give you the tool, I can advise you, I can guide you, but your health is your responsibility, not mine. And you need to be responsible. And for you to be able to be responsible for your health, you need to be aware. And part of what I think, going through the process of me asking questions all the time when you come to the clinic, especially when we deal with a lot of internal issues, you start paying attention to those things. Because before you didn't pay attention to your bowel movement, or maybe you not paid attention to your digestion, or you didn't pay attention to how many times a day you sneeze, and you haven't paid attention to a lot of things that now you're paying attention to. That's just raising awareness and consciousness, not increasing anxiety. And if it increases anxiety, that's something we need to talk about. But it's really just about raising awareness and consciousness, because you need to know where you are. That's just part of us as being, and us being responsible for ourselves. So, questions? Does anybody need a break? We have 3 more hours. No, I'm joking. So, when we're talking about Zen masters, oh no, that's the wrong lecture. What I want to really lay out the foundation for the organ system, when we're going to go into each organ separately and specifically. But when we're really talking about dynamics and we're talking about the relationships and the element, so we talk in Chinese medicine about, I don't know if you guys heard that, the 5 element and the 5 element theory, which is one school of thoughts within Chinese medicine. So when we're talking about that, we're talking about the fire, we're talking about promoting, we're talking about earth, we're talking about metal, we're talking about water, and we're talking about the wood element. We okay? Okay. Now when we're talking about the fire, I'm going to focus on what we call the yin organs. There's the yin organs and the yang organs, and they're paired, husband and wives, and there's a lot of relationships there, but we're not going to go into that tonight. I just want to lay the foundation. So fire, we're talking about the heart. Earth, we're talking about the spleen. Metal, we're talking about the lungs. Water, we're talking about the kidney. And wood, our all-time favorite, the liver. Now, we have a few different cycles. The first one is the promoting cycle, or what we call the generating cycle. Wood generates fire. Fire generates earth. Earth generates metal, and continues like that. This is also what we call in Chinese medicine the parent-child relationship. A lot of time in heart pathology, we're talking about lack of nourishment. We're talking about issues that have to do with the parent not giving enough to the child, and therefore the child is weak and suffering, going back to even though the heart manifests the problems, it's not a heart pathology. It started somewhere else. So you need to work on that relationship. A lot of time with liver problems, we see kidney not nourishing. That's actually very common, talking about kidney, and we're going to get into that. That's actually a very common relationship in menopause. You see a lot of liver issues, but it's actually not a liver pathology, because just like other parts of life, when our parents abuse us, we carry the consequences of that. So we manifest it in life because we go around manifesting it in the world, but it's really due to what happened with that relationship. And this is really where the issue is. And by fixing that, now the child gets nourished, and a lot of those manifestations and symptomology goes away. Now, the second relationship that we have is what we call the controlling cycle. Now, the controlling cycle is what keeps things in check. Now, interestingly enough, again, we talked about society. Talking about Taoist and Chinese culture at the time, it was the parents' responsibility to nurture the kids. It was the grandparents' responsibility to educate. So they were the controlling ones, when the parents were the spoiling one. In the West, we have it exactly the reverse. The parents, we educate our children, the grandparents spoil them to death. Chinese culture was exactly the opposite. So that dynamics we see that are closer to the Chinese culture, which is the grandparents educate and control, parents nourish. And a lot of it had to do, and you see that in a lot of old world cultures, is the parents work. The grandparents are at home with the kids. So the parents come home at night from work, what do you want to do? Play with your kids, have some fun. The last thing you want to do is now yell at them and go do your homework. And the grandparents were with them all day long, so they were the one who educated them. And the controlling cycle is fantastic to keep things in check. When problems arise, when it's over-controlling or overbearing, and now you have somebody that not just keeps you in check, but starts really keeping you in check. So a lot of times, and I've noticed from my experience since I've been around the world a little bit, that different cultures, different places seem to develop similar disorders that are very unique to their part of the world or their lifestyle. That relationship, right there, the most common, this relationship right here is the most common one in Los Angeles. This is our dynamic, one of the most, I'm not saying the only one, but the most common within our lifestyle, liver and the spleen. So the liver, to make, now there's one more cycle, just to mention it for that, even though we're not going to touch on it a lot, is that what we call the rebelling cycle, that you push somebody so much, they just go bonanza back on you. So that's actually the reversal of that relationship. It will go the same way, only in reverse. Now, very interesting, when we're talking about that dynamic, when we're talking about the liver as being the wood element, so what we're talking about really from Chinese medicine perspective, it's about growth, about maturation, about change, about expansion, about renewal. All of those are the qualities of the liver, the wood element. So, and again, we're talking about concept. If we're talking about organs, we will talk about tendons and ligaments, and we will talk about the eyes. And one of the most common things that we're going to look into that is migraines. But also the emotions are anger and anger aimed inward. Does anybody know what unexpressed anger or anger aimed inward is? What's the opposite of expression? Depression. So when we're talking about rage or depression, are both liver pathology. So when you see somebody going postal, it's classical what we call in Chinese medicine liver qi stagnation.
Liver what?
Qi, the liver energy is blocked. Also when we're talking about depression, we're talking about liver. And now we're also talking about, from medicine perspective, we're also talking about certain cultural things that we were accustomed to. Men don't cry, but it's okay to show violence and anger. Women, it's not appropriate, it's not ladylike to show anger and violence, but it's okay if you cry. So men tend to manifest more rage. Women tend to get more depressed because society teaches us that this is appropriate and okay for us to manifest our issues like that. So a lot of times when you see that, you also have to take these things into account as to, wait a second, what's going on here and why this one manifests this versus this one manifests that. So when we're talking about that, again, we're talking about anger, we're talking about depression, we're talking about frustration, we're talking about lack of growth, and we're talking about growth. It can be in your career, it can be in your own personal expression, because what we're really talking about is lack of expression. You are not manifesting who you are in the world. You are not really living up to your potential, versus something is happening in life that's preventing you, or you yourself have lack of nourishment that doesn't give you the ability to go out and to do that. So when we're talking about stagnation, we're really talking about two different types of stagnation. We're talking about an excessive type of stagnation. It's kind of like the freeway, the 405 or the 10, at 4 in the afternoon. There's just too much, there's no movement. And then usually you see that because you see that vibration and they can't sit still and they come in the office and they're all and you can't talk sense into them and like Claudia I heard, and you can see that in people you walk, and you can start recognizing that this person is having some major stagnation, but it's from excess. Versus you have the other person who is stuck, kind of like a boat in the river, because there's not enough propelling force to initiate movement. There's usually the guys who come to the office and they're very timid and they're quiet, and no matter what they do, they just can't seem to get things moving. And we don't understand why nothing goes my way, and I can't create anything, and I'm stuck in my career, and I don't know what's going on with me, but I just can't get myself motivated and driven to create. The excess will come from here, straight liver pathology. The deficiency, there's lack of nourishment somewhere, and that's where you need to look at. There's a certain relationship, again, within the organ, or we can look at other aspects of life, and if we need to talk about it, or whatever that is, to identify, maybe it was an over-controlling parent, or not a nourishing parent, that's something that prevented you, it didn't give you that confidence, or that self-esteem, or that whatever it is that you needed for you to go and initiate that movement. So you're stuck. Either way, you're stuck. So when we're talking about that being stuck with all of those emotions and those things that are either happening or not happening to you in your life, and now you're starting to manifest them physically. So we're starting to talk about migraines. We're starting to talk about now we can talk about blood work and elevated liver enzymes. We talk about issues that have to do with the eye. So you start seeing a lot of vision issues, a lot of blurry vision. Even more severe than that, we're starting to talking about vertigo or dizziness, or stroke will be the outmost. Because what we're talking about is the outmost lack of movement. Things are so stuck that they seized. There's no more movement. And usually you see these people try to create movement in their life even though they don't understand it. So they either pace a lot, you see them sitting but they're restless, their legs usually shift, things. Sighing is one of the common signs for that. They love exercising because anything to do with running makes them feel good. Alcohol, all of those things that are trying to generate movement inside the body one way or another. And usually after that kind of intense, you usually see them going until it builds up again, then they go through that again, unless you diffuse it and move it. But what's interesting talking about that, now, this is really, we can look at all of this as stress. And we all view stress as an emotional thing, but we don't understand how our lifestyle, sugar, chemicals, electricity, computer, phone, actually puts a lot of stress on our organ system, on our body, on us, whether we understand it, we accept it or not. It is stressful to us, it's traumatic. So it's affecting again, the liver. Now, when the liver gets all hot and all upset, it's kind of the bully. It beats up on the spleen. Now, when we're talking about the spleen, what is really the spleen in Chinese medicine? When we're talking about the spleen in Chinese medicine, what we're really talking about is the digestive system. So what we're talking about is now issues with food, which is really what we are talking about is what are we putting in our mouth, how we break it down, how we process it, what we extract out of it, the nutrients, and how it is that we are able to successfully extract the nutrients to benefit us and get rid of the toxic elements in our life. We can look at it from a metaphorical perspective and talk about our life's experiences. What it is we do with them. How do we swallow our life? And we use the expression, I swallow my pride, or that's something, do I have to swallow that from him? Or what we're really talking about, how it is I take life's experiences, how do I break them down to something that is digestible? Now, how much of this am I able to take, extract the nutrients, the things that will benefit and enrich my life, and what it is that I can take from that and get rid of as waste, the toxic parts and the toxic elements in our life. Now, any breakdown in that process, we either don't digest, we don't break down, we don't extract the nutrients, or we can get rid of toxic elements. So now we're talking about anything from indigestion to ulcers to Crohn's and ulcerative colitis. Going down the chain. Again, we can talk about it from what is happening in your life, or we can talk about it from a physical perspective as how it affects us or what kind of diseases we're going to develop. Now, we're talking about the extraction of the nutrients and how it is we're benefiting from that. So now we're starting to talk about unexplained or issues with weight gain. So what we're really talking about is thyroid function, or a lot of times you see people that have certain weight issues even though their thyroid function is normal. I actually had a new patient like this today in the clinic that came in that all the blood work, thyroid function, everything is normal. But she keeps gaining weight, nobody understands why. I did the intake, I asked all the questions, you guys know my forms. She was classical. She'll be fine in a few months. But it was the same dynamic. The liver beats the spleen so much, and the spleen manifests. Now, another interesting thing, and now we're going into secondary pathology. We have a saying in Chinese medicine,
So how do you treat someone like that?
strengthen the spleen, but you gotta reduce the liver. If you don't move the liver, last lecture they laughed at me that I use a lot of the feet point. Those are liver points. When people come in the office and they go, oh, this producer, that, and then I'm just waiting, and they tell me all of that stuff, and it's like, okay, just take your shoes off, lay down, because I already know I can see that stagnation coming up. So if I don't diffuse it right then, you're going to start having a lot of those issues. And now this one is upset. So now the heart is not being nourished. So not only now your digestion is not working and you start burping or you have some issues, but the second thing you're looking for,
Stress points.
you
Take my socks off.
we're not going to talk about that. But,
He goes in and flip-flops every day.
but really, what I'm doing is moving the liver. Because if I don't move the liver, the next thing I'm looking at is either having some kind of stroke, some kind of issues with digestion, or since it's not nourishing the heart attacks, cholesterol. We have a saying in Chinese medicine that even though phlegm is being produced in the spleen, it's being stored in the lungs. Bronchitis, asthma. Yet they're looking for the, cystic fibrosis. They're looking for a lot of it in the lung, but they will never find it in the lung. And again, doing the intake, doing the whole picture, I know that again, remember how we start talking about it?
We need to change tape.
Do you need to change tape?
Yeah.
Take a break. Change tape.